Good afternoon to all of you. First of all, I thanks to this portal for inviting me and sharing my view on the topic of this. My bottom of the heart is the anatomical perspective of the asana. So, why this topic is very important in nowadays? Because when our Honorable Prime Minister, the first time they explain about this 69th nations, the significance of this yoga in the community and how this yogic is important. And earlier I was taking so many class in the yoga, but what I observed that when we are performing this yoga, some of the participants, they will not perform the asana well. So they will not get proper benefits. So I start being in my anatomical view how this anatomy is important because it is very, very popular in the western area as compared to the eastern area, but the yoga is, you know that, it is the eastern science. So by the knowledge of this anatomy, we have to understand the deeper and the advanced aspect of the practices, and also we can avoid the related injuries, and we have to become a very good yoga medical therapist. So as we are all know that there are the different variety of the asana. Some of the asana where we are having a forward bending, some back bendings, twisting asana. Out of this is all the asana, the area which are commonly affected is our core muscles. Is a main important where you know that. So this core is formed by the abdominal muscles, front and the back muscles. And the different research study, they explain that if your core muscles it not work properly, so it can lead to the various kind of the musculoskeletal injuries like the lower back pain, the ankle instability, other things. So it is very, very important to you to understanding the weakness of the core muscles. It can affect the lumbar spine, the poor endurance of the muscles, the back injuries, the imbalance in the hip extensor muscles. So therefore the proper activations of this core muscle is very, very important. So how we can activate properly these core muscles? What is our approach to the yogic asana? So we can understand these are the four important components of the core muscles, the abdominal, back and the hip and the pelvis. So let us try to understand one by one. These abdominals having a 4 parts. Out of this, the back, the first one is very, very important. And look here, the 2 parts, one is a stabilizer, the muscles of abdomen which are very deep is a stabilizer and the superficial is the mobilizer. So suppose when the persons are very, very obese, like you can see the first year medical student and the final year medical students, and you see how the obesity is there. So which important asana is very, very effective for that? So the asana is the Chaturanga Dandasana. Why it is very effective? Because the obese person particular, the most commonly muscles which are weak is the external oblique muscles. It is the research study will explain about that. So if you see that this NI et al, they observe that they are putting some electrodes on the surface EMG and they observe that the external oblique muscles is highly activated when you perform Chaturanga Dandasana. So that's why if you have some problem with like that, if your external oblique is weak because it is a mobilizer muscle, so you can do the Chaturanga Dandasana and within 1 month you will see the defect of that. Another important muscle, suppose the Swami Ramdev ji is most of the times they are explain what is the importance of this Udyan Bandha and the other Agnisar and the Noli Kriya. So you can see the transverse abdominis muscles which are the very deep muscles, and our different literatures, yogic literatures, they explain about the Haryog Pradipika. Why the practice of this particular Udyan Bandha is very, very effective. They explain the Udyan is very, very easy, but you have to be learned from the Guru. And suppose you are practicing daily this Udyan Bandha, so suppose you are feeling old, aging effects, you feel energetics and the young. So that is the beauty of this Udyan Bandha. And another important things, the SN Omkar, they study that, they are study on this particular, the transverse abdominis muscles and the ultrasound image. So you can see here, before performing this, before performing the Udyan Bandha, there is a 10.5 mm muscles of transverse abdominis muscle recruitments, and after the performing, there are the 17.5 muscles. So how the muscle is engaged when performing this particular Uddiyana Bandha, and how this Uddiyana Bandha is very, very effective for the lower back pain. So these are some research study will explain about that. The practice of daily this Uddiyana Bandha will be very, very effective. Now, the most important muscles, if my question to you, which muscles form the pillar of your body? This is the pillar, Eiffel Tower, you know that, all of you know it. And the Eiffel Tower, this muscle is very, very important to maintain your Eiffel Tower. Nowadays, because of the age is advancing, you have a tendency to fall down in the front. So, the yogic asana, which are very, very effective for to maintain this Eiffel Tower of your body, is your iliopsoas muscle. I have done the various workshops on the basis of the yoga anatomy, where I explain that the which important yoga postures is very, very effective for the iliopsoas muscles. So here you can see my workshop, and where I just try to focus to this. This is called the Manjari Asana modifications. So here you can see all my participants, they are performing these asana practices. And also we have published some papers on the hip musculature, the correlation of the functional anatomy of the hip musculature with the yogic postures. These are my review papers. So where we explain these hip muscles, particularly the gluteus maximus and the gluteus medius. If these muscles are weak, it can also be lead to the various type of the problems like the patellofemoral pain syndromes, the iliotibial band syndromes, the anterior cruciate ligament injuries, ankle instability. And we can also perform this some kind of workshop, yoga anatomy workshop. So in this my workshop, the more than 80 participants, they are present, and they can see how the different yoga asana, what are the different limitations. Suppose you can see in my workshop, we can divide in a two group all the participants. One participants, they are performing the asana. So you can see here, this is the participant performing the asana, and this is the participant who are observing the asana. So two group. So suppose if you are observing the asana, and we have also given some kind of the questionnaire to you. So these are the questionnaires, and after that the different these things we are found that the postures which they are performing, the triangle posture, the warrior 1, warrior 2, the chair posture, the 3 postures, the T posture, the harpoon postures. And what we observe that the most of the participants will not able to perform the hold to the raised legs, maybe because of the glutes mates is decreased theirs, and the 26% of the participants will not able to perform the foot of the lifted leg facing down rather than the extending out. So that is some common findings apart from the other findings we are also observing in my workshop. So what we can do for that? So normally when we performing this warrior posture, so the study will show that the glutes mates is highly activated when you performing the back leg. And another important asana is called the Setu Bandha asana, the bridge postures. So in the bridge postures, you can also observe that the tilting on the pelvis on the posterior sides. And nowadays, you can also see this gluteus medius muscles, their weakness is very, very common. And the gluteus medius muscles is the most important muscles which are providing the stability of the body. They are the balancing muscles. So my one study will show that the gluteus medius muscle activations and the hamstring muscle activations and the gastrocnemius muscle activations, the Utthita Hasta Paduksasana and Vikshasana. So what we have observed that the participants who are performing this Vikshasana, they will show the high level of the gluteus medius muscle activations as compared to the other muscles. So that is a treatment of choice for the geriatric rehabilitations also. And the hamstring muscles is nowadays, I have also published the one papers on the functional anatomy of the hamstring muscles and its correlation with the various yoga postures, my review paper. So here you can see that this is the hamstring muscle is there. So whenever this muscle is very short, it can affect on your lumbar spine. And we can also see in my workshop that the group A and the group B and the particular 12 subjects, they having a hamstring less than 65 degree. And whenever the hamstring will less than 65 degree, they can also affect the changing the lumbopelvic rhythm and the non-specific lower back pain. So many issues of this particular the shortness of the hamstring muscle. So we can also address this if you have a hamstring shortness. So we can also first correct the hamstring length. Now this picture, you can understand this picture is we show the modern problem in the common lifestyle. Now you see that everybody are busy with the computer and the mobile, the forward head postures. So they can also lead to the different problems like the neck pains, and also the research study, it showed that the postural corrections for the kyphosis improve the dyspnea index and the pulmonary functions in the patient with the chronic obstructive pulmonary disorder. This is randomized study is there. So also what we can correct and which of the important asana we can correct these kyphotic postures. You can see here our ancient literatures, this Grand Sahinta, they explain about this Bhujangasana. When you performing the Bhujangasana, it destroys all the disease. And practice on these postures, it's awake the Kundalini force. So that's why our Honorable Prime Minister is always promoting the Bhujangasana to the community to perform the Bhujangasana. And meanwhile, I also publish the papers on the biomechanical aspect of this Bhujangasana. So where I explain very detail about that, these muscles, how this muscle is very, very effective for that. And lastly, I will talk about a few words about the pelvic floor. It's very, very important nowadays, the levator and eye muscles which form the pelvic floor muscles. And these pelvic floor muscles, you know that is a ligamentous muscular apparatus which provide the supports to these pelvic organs. So we are also published one papers on this exploring the significance of mudra and bandha in the pelvic floor dysfunctions. So where we are choose the three important exercise. One is called the Vajroli mudra, Asuni mudra, and Mula bandha. So in the Vajroli mudra, we have to be just strengthen these urethral sphincters. So it can also correct the bladder neck dysfunctions and the urinary incontinency and the premature ejaculations. Another important asana is called the Asuni mudra, where we have to be engage our anal sphincters. So they can also very effective for this piles prolapse of the uterus. And now the last one is the Mula bandha. In the Mula bandha, basically we have to be engage our pineal body, and this pineal body, it's very effective for that to maintaining this strength and integrity of this pelvic floor muscles. So that's all these things is very, very important when we talk about this particular the effectiveness of the yogic postures on this pelvic floor. Now we have to be published on this one paper on the anatomical correlation of the core muscle activations in the PubMed journals. So here we are just trying to explain the different muscles, the external oblique muscle, rectus abdominis muscles, and what are the important asana. So these are the study where we have to be compile all the muscles. So by these muscles, we have to be understand the which important muscles is very, very effective for these different asana. So that's the things what I try to giving the message to you. The asana is a very, very important, and in the asana particular the core muscles is very, very important, and the knowledge of this core muscle activation and different asana can assist the health care practitioner to make appropriate decisions for the evidence-based yoga interventions. So once again, thank you all of you for try to understanding the new concept, new innovations in the field of yoga, the anatomical approach of the yoga. So thank you all of you.